Hi, I'm Sreeni Venugopal, Group CIO and CISO of KIMS Health. Some things that we have done, I always say that, we did more digitization and IT initiatives in the last 2 years of COVID than we did in the last 15 years, because we were driven to do that. One of the first things that we did was to develop a very comprehensive mobile app because we wanted the process of healthcare to be touch free during the COVID time. So when people come in, they have to go to the registration counter, they touch a few things, they fill in paper, then they go somewhere, they make payment, there's money exchanging, their pharmacy, etc. So we had this completely touch-free system through the mobile app where people can book their appointments, make their payments, come and meet the doctors, pay for their radiology services, get their reports in the app, prescriptions in the app, and they're reminded when it is time to take medicines the next time, right? So these kind of things, one of the first technology initiatives that we did from a COVID perspective, and that has been very successful and very well used by our patients, and they're very appreciative of that. The second thing that we did was to bring in AI/ML solutions in radiology diagnostics. So during COVID, there was a surge in the number of X-rays that were done, chest X-rays, the number of scans that were done, and so we bought in a external solution that used AI/ML to detect the presence of COVID or the presence of any other abnormality in the X-ray. So that was very helpful for us from that space. Some other initiatives that we have done. One, I spoke about the patient safety initiatives like counting and tracking of surgical equipment. That helps us a lot. We have Iot initiatives within the hospital that tracks the blood samples that are moved across different parts of the hospital until it reaches the lab. From a business use case perspective, earlier we had missing samples, which meant that the nurses had to go and take blood again from IP patients, which is quite frustrating for them. So there are many things around that space, and one other key initiative is the business intelligence and analytics department that we have set up, which is now using our last 20 years worth of data to do predictive analytics. The number of things that we've done in the recent past. One is the top priority is always patient safety. So one of the hospital information system changes that we are bringing in is called closed loop administration, which means usually there are a more than necessary, I would say, percentage of errors with medication, not in our hospital per se, but in global averages, right? So and for patients who are admitted in the hospital, when medicine is administered, sometimes it's missed, sometimes it is a wrong medicine, sometimes it's not on the right time. So we are having this closed loop administration being implemented where all the medicines, when they're administered to patients, the nursing staff will mark that on a tab, and we will trace the path of the medicines from the pharmacy to when it was administered to when the patient got discharged and so on. So now it's called that process is called closed loop administration, and that's something we are implementing from a patient safety perspective. Some other top focus areas for us is business analytics, because we have realized that there is so much more that can be done from a predictive perspective, and we have a team set up for that now, and we are quite focused on it. Another area is cybersecurity and privacy. Healthcare is, I would say, I think the second or third most attacked domain out there. But more than the number of attacks, the cost of a healthcare breach is much higher. I think it's an average of some $500 versus 150 or so dollars per record that is breached. Comparing, if I compare healthcare to automotive or healthcare to banking, so it's very costly to get breached. And so one key initiative for us is strengthening our cybersecurity posture and making sure that the patient data is kept secure and private. And I would say finally, remote collaboration is a way that we are looking at, because I think rather than working in silos, if we are able to bring in technology tools that allow us to collaborate with other hospitals and care providers for surgery, for treatment plans, etc., then that will be much more beneficial for our patients. So remote surgery, platforms that are built for knowledge sharing, etc., are a fourth initiative that I'm driving in the coming year.
For more updates from CXO TV, please like and subscribe to our channel.